Now I'd like to invite our three speakers, including Dr. Hu from last night, to come up. We'll have a question and answer period. If you have any questions, please pass them to one of our staff members, and we'll try to get to as many of them as we can. Okay. Our first question is, Dr. Hu mentioned that Congress doesn't want to discuss environmental effects of diets. This was last night. How do policymakers deal with the suggested reductions in meat consumption, given the influence of lobbyists and the livestock and the dairy industry? Start with the easy questions first.
All right. So people are still thinking about what I said last night. Well, certainly this is not an easy. There is no easy answer to this very complex question. I think we have to start from the grassroots. A lot of things in the U.S. Being done at the grassroots, at the city, in the cities, at the state level, rather than at the federal level. I think climate change is a good example. As you know, I mean, currently the federal government is not moving forward with any of the environmental initiatives. However, many cities are doing great job in terms of developing environmental sustainability initiatives at many levels. And I don't know about Pittsburgh. I know Boston, San Francisco, New York, and I think they are moving forward with many environmental initiatives. In terms of beef and dairy, I think it's correct that the powerful lobby in Congress, they have stored many of the recommendations in terms of reducing meat consumption. However, I think there is strong scientific evidence that higher consumption of red meat is detrimental to human health and the health of the planet. And many of these recommendations have been made not at the federal level, but have been made at local levels, and also in other countries. For example, in Canada, as you mentioned earlier, the recommendations have been very clear about the consumption of meat and versus plant-based foods. Many European countries have also adopted recommendations to reduce meat consumption as one of the strategies to improve human health and the health of the planet. So again, I think there are many ways for each of us and for our communities, for our families, for our cities, and for our states to move forward without the explicit endorsement of the federal government. But this is going to change. I don't think the policy makers will just sit there idly when we see the damages that have already been done to our health, to our environment. I think at some point the federal government will take actions and will use the best available evidence to develop policies that can improve the health of our people and also the environment.
Yeah, I think our federal government does tend to be followers, not leaders. Dr. Parkinson, you did mention Canada. Do you have any kind of follow-up that you'd like to mention about this question?
No, what I would just say to colleagues in the room, and we're all engaged in this topic, whether we're healthcare providers, veterinarians, others, is I found it very instructive to the, well, it just doesn't apply here argument that we hear all the time, one way or another, either back of the hand or directly, to just point north 6 hours I can get in my car and I can be under a totally different food guidance system, and yet they look kind of like a lot of people south of the Canadian border, right? And so why can't we as professionals, as colleagues, begin to dispassionately discuss the science that Dr. Hu talked last night, and how can we begin to move the needle locally, regionally, nationally, and use them not necessarily as a model, but as at least a way to think about dissecting health effects versus what might be economic desirability in terms of international trade and things like that. They do it quite cleanly. And it's quite clear that the document for the people what to eat is not necessarily what their export business says they need to do. And there's a lesson there for us, I think.
Great, thank you. Dr. Michel, many of the pet food companies that make pet food are the same companies that make junk food for kids. If they don't care about our kids, what are they giving our pets?
Yes. That's a very astute observation. And it continues to, that trend is continuing where I'm not sure which major food company just acquired Blue Buffalo, but that's no longer a privately owned company. So I think this is a difficult distinction to make sometimes, because there's no question that pet foods are processed foods. But it's different than the typical junk food. Commercial pet foods are regulated to be complete and balanced. And yes, the finished product doesn't really bear a close resemblance to whole foods or natural foods. But it's not manufactured and processed the way we think of. I think we just saw some data on processed foods being very high in sodium, fat, simple sugars. That's not the way pet foods are manufactured. That's not to say that there aren't segments of the market that work along those lines, such as some of the foods that are marketed to look like people foods. So I don't think we have Gaines burgers anymore, but you probably all remember them. And those are highly processed and have lots of additives in them to make them look that way. A lot of the treats as well. But pet foods in general are pretty nutritionally sound. And the worst thing I can say about a lot of foods is they contain excess amounts of protein. It's not harmful, but it's wasteful to have the excess protein in these foods that the animals don't need in terms of their nutritional requirements. So I hope that addresses the question. Yeah.
Thank you. Dr. Parkinson, you cited a lack of time with patients as a barrier to addressing lifestyle diet. How can we help change that?
Well, I think that I'll tell you strategically, if the time is well spent, 15 minutes can be extremely impactful. And many of my colleagues would think that more time is better, but if you don't have the skills and you don't have the knowledge, what's the point? So I see some heads nodding here for some of my physician colleagues. So designing systems of care so that the expertise of the physician, and for that matter, the nutritionist and the nurse practitioner and everybody else on the team is maximized, will help us leverage the professional voice. So the power of the white coat, which I tell my colleague, is oftentimes it's a placebo effect. It's the effect of the priesthood. There's a lot in medicine that unfortunately patients know is more art than science. And so leveraging that in an effective 90-second to 2-minute prescription writing exercise, which is what we do in Prescription for Wellness. And then we have an entire team that fills that prescription for the patient with 6 to 8 week health coaching sessions with curriculum that's skill building, and the doctor gets a report back in 30 days. Physicians love that because you saw on my slide, they don't know anything about nutrition. They don't really know anything about stress management, and so it makes them look good while they learn from their patients. So innovative models like that, I think, Richard, are what we have to do and get out of this scene that I can't do anything unless I have more time. I don't agree with that whatsoever. I think we have to redesign systems to make time most effective at the level of health professional and even just peers to help each other to do what we need to do at a cost-effective way.
Great, thank you. This is a general question. Food justice and environmental justice are part of this discussion on diet and health, and it's the one that's most often overlooked. How can we improve access to lifestyle medicine changes and healthier spaces?
Hello? Okay. Just thinking about utilizing our spaces, I think, when I was talking about responsible food sourcing as well, that's a great one where we can really source locally when we're thinking about food justice and supporting our local food economies as well. We can also think about on-site food production and using ways to actually these opportunities to increase opportunities for food production. I think food justice is really important too, because there's a lot when we go in and we try to make changes, and then we typically, especially with like certified organic, that's one thing that we come back and say, you're not helping the small farmers or these smaller farms who can't afford to be certified. And so where can we find equivalents and for that? And so it's something that we do in the standard is we look for equivalents and or alternative strategies that are just as good if not better. So that's one way that we address it in the healthy building space. But
yeah, I just want to emphasize that health disparity in food have become a major problem in public health. What we have seen in the past 2 decades is that the gap in terms of food quality between the poor and the rich, and also between different ethnic groups, have actually widened in the past 10, 15 years, especially after the financial crisis. So we look at the National Health, Nutrition Health Interview Survey, and the Healthy Eating Index that I mentioned last night has improved in the people with higher socioeconomic status, but actually get worse in people with lower socioeconomic status. And that has contributed to increased prevalence of obesity, diabetes, and cardiovascular disease among poor communities. So I think in terms of food justice, we really need to address the issue of food desert or food swamp in poor communities, in vulnerable populations, and we need to make healthy foods more accessible, more available, and more affordable. And some of the federal nutrition assistance programs have not been very helpful. For example, the SNAP program, which involves billions of dollars of each year to help poor individuals and families in terms of food assistance. But almost $3 billion of the SNAP program money has been spent on sugar-sweetened beverages. And that has created a vicious cycle, because those people are already at high risk of obesity, diabetes, and then they use the SNAP money to purchase more unhealthy products, and that lead to more health consequences, and cost more money to treat their obesity-related problems. And I think that kind of policies need to be changed so that you can use the money to incentivize people to purchase more healthy foods, and de-incentivize people to purchase the unhealthy foods. But I think this has to be done at the local, state, and the federal level, and that's the important part of the food and the nutrition justice.
So this is a great question. And many of you know who are in healthcare that I call it the buzzword du jour right now is social determinants of health, okay? And I don't mean to be demeaning, although it sounds like that, because 30 years ago, Frank, we used to call that public health. Now it's called social determinants of health, because that's another whole area and it really gets to this inequity and disparity between the haves and have-nots, which, to Dr. Who's point, is widening, not narrowing. Those of you who couldn't be here last night, with all deference to Dr. Who's great presentation, the one that blew my socks off literally was Gabe. Gabe is here putting in box gardens throughout our community, and not just Gabe, but the whole FIPS team and the communities that do it. Because more and more at the health plan, what we're thinking is, unless we make it local, unless we make it experiential, unless we make it competency building in the people who live there, it doesn't matter really what we do in a 15-minute office visit, with all due respect to thinking about social determinants of health from the office. So the things that FIPS is doing at the local level, to Dr. Who's point, how many people have sponsored 10 box gardens in their community? Not me. I'm embarrassed. I should do that. I don't know how to do that. I should sign up for that right away. Because once people do that, they own it. I'm very worried about well-meaning but unfortunate simplistic programs like food is medicine, let's ship you a box of food. No. Let's teach you where food comes from, like the kids did here at FIPS. Let's help people grow it in their communities so they know where it comes from and develop the self-efficacy of eat, move, think, because gardening is what? Aerobic. They actually get activities while they do it. I mean, this, you know, we need the Peace Corps model. I want to teach you how to fish. I'm not going to ship you a box of fish. And oftentimes the food quality that comes from our food banks is not the types of stuff that we want people to eat, because it's loaded with salt, sugar, fat, processed foods, and we're not, so it could become an inadvertent, now don't get me wrong, don't print that I'm against food banks, but I mean, we have to begin to understand the personal worth that people achieve when they turn that back lot into that garden and then basically eat that food through the help of FIPS and other types of organizations. I think that's the way forward. That's the way forward. And it lives on top of everything we do, but it's a deeper level.
You know, I just want to comment on, thank you for that comment, Dr. Parkinson. I'd like to say that our homegrown program is probably our most successful program we've ever done at FIPS. And I never thought of asking people to individually sponsor a garden. So coming soon to Pittsburgh, you will all have a chance to sponsor a garden in somebody's house in the very near future. So thank you very much for that great idea. Yes, Dr. Michel.
So I'll come at this from a different angle. I touched a little bit on this human food trend in pet foods, and I'm deeply troubled by this. This is something that the Association of American Feed Control Officials, which is the regulatory body for pet foods in the U.S., pushed back against a lot. So they regulate how foods are labeled, and they basically said, this is meaningless. You know, once food leaves the USDA monitored system, it's no longer fit for human consumption. You just can't tell somebody that your pet food has human grade ingredients in it. It's not true. Well, they've caved, and it looks like they're going to allow this labeling. They're still working out the details, but I guess they're going, the way they're going to get around it is they're going to have USDA inspection in pet food plants. But the bottom line is, I'm deeply troubled. I know we want to feed our pets well, but the idea that we would want to feed them protein and other nutrient sources in direct competition with human requirements in this day and age is deeply troubling to me. And it's just something that I think needs to be thought about a little more carefully before we actually sanction this, which is where we're going.
If I may, Doctor, I would love to talk to you offline. This is the reason that veterinarians talking to human physicians and the public health community works. So we should craft a resolution to the American Medical Association, national policy on this issue from the AMA, that I would be willing to get the right people to put in the submission to raise it so that the health profession and the environmental community can say this is a wrong direction and what can we leverage our voice going forward, because that's why these meetings are so helpful. So I think we'll talk offline.
Excellent.
Great. Another question is, when it comes to increasing fruit and vegetable consumption, shouldn't we put the focus on getting people to eat more rather than pitting organic against conventional?
I could say just a quick, I'll let Dr. Who speak to this, but one of my nourishment advisors, Dr. Alice Lichtenstein, who was also on the Dietary Guidelines Committee with Dr. Who, and she always loves to make this distinction between that we shouldn't, that our goal is to increase fruit and vegetable intake, and it's not only to increase it, it's to replace. So we don't want people just eating more fruits and vegetables. That's also, I think, we need to be careful when we send the message. They need to be replacing other non-healthy foods with fruits and vegetables. And we don't focus a lot on organic because when it comes to fruit and vegetable intake, you can still get healthier, or you can get, fruits and vegetables naturally. You can get non-conventional or organically grown. You can get canned. Make sure there's no added sodium. That's all contributing to your fruit and vegetable intake. And a lot of times that's also what we measure at this the index level too. So in our standard, and I think we do want to promote, that's why the intent is to reduce pesticides and to reduce exposure to antibiotic resistant bacteria, not to increase fruit and vegetable intake, but that is a benefit that you get from it too.
So last year, JAMA Internal Medicine published a very interesting study from France. It's a very large cohort study with more than 70,000 people, and they analyzed the relationship between organic food consumption and the risk of cancer. What they found is that regular consumption of organic foods, including organic fruits and vegetables, organic meats, even organic wine. I don't know why they have organic wine in France. Overall, look at the overall pattern, not just individual foods. What they found is that there is a 25% reduction in the overall cancer incidence, and in particular, there is a significant reduction in breast cancer risk and lymphoma. So that study was quite provocative because this is the first large population-based study to show the benefits of organic food consumption on cancer prevention. So my colleague Jorge Chivaro and myself wrote a commentary on this study, and what we said is that this is an interesting study, but there a lot of limitations because it didn't specifically measure pesticides levels in biological samples, and the assessment of organic food is very challenging in free-living populations. Nevertheless, I think the results are interesting, but they need to be confirmed in future studies. From a practical point of view, I agree that in the general recommendation in terms of increasing fruits and vegetables, whether they're conventional or organic, should still be the primary strategy to reduce the risk of cancer and other chronic diseases. However, in terms of personalized or individualized recommendations, if you can afford organic foods, of course, you should do that. But I think the general recommendation on increasing fruits and vegetables is still the primary strategy for reducing risk of cancer. And the French study, I think, has provided an important stimulus to conduct more studies in this area.
That's really interesting. I wasn't aware of that study. I do know that a lot of times, I'm just adding a friendly amendment to your commentary. A lot of people say they can't afford to eat organic, everything organic, and the Environmental Working Group does put out a list every year of they call it the Dirty Dozen. It's the top 12 fruits and vegetables that typically test for the highest level of pesticides. So if you can't eat everything organic, at least try and eat the Dirty Dozen organic, and you'll save money and also reduce your exposure to a lot of pesticides. When it comes to, I already read that one. To what extent is fish production and consumption part of the problem or part of the solution? Fish. Oh. We're seeing a lot of, farm fish right now.
Yeah, this is a complicated question. I mean, it certainly involves both health and environmental issues. From a health point of view, I think consumption of fish and seafood is considered as a part of a healthy diet because the evidence is pretty convincing that higher consumption of long-chain omega-3 fatty acids from fish and seafood have been found to be beneficial for the prevention of cardiovascular disease and other chronic diseases. So the question is whether increasing consumption of fish would contribute to environmental impact. I think this is, of course, a very complicated area because more and more fish is now farm raised, and the environmental impact of farm raised fish is different from the wild fish that you catch in the natural environment. And another issue, of course, is the contaminants in fish, especially mercury and other pollutants, and which may offset the beneficial effects of non-chain omega-3 fatty acids. So I think overall the environmental impact of fish and seafood is much less than meats, than especially beef. However, I think we have to be very mindful about the pollutant, mercury and other pollutants in fish, and also the wild fish stock that is being depleted because of the overfishing. So I think those are all the important issues to consider.
And I'll throw in one more thing about raising fish, just like raising any animal. I mean, it's those omega-3 fatty acids are essential fatty acids, and if they're not in the fish's diet, they won't be in the fish. So they're in the wild-caught fish because they're eating their natural diet, but we raise fish on all kinds of stuff when we farm them, and so they aren't necessarily good sources of those nutrients we're actually seeking when we partake of seafood.
What if the fish eat a bunch of walnuts? Does that help? No, I'm just kidding. I don't know.
Actually, it's those long chain polyunsaturated fatty acids that we're looking for, like EPA, and they're not going to make them. Yeah.
My colleague Eric Rim did a parallel analysis of non-chain omega-3 fatty acids in farm-raised salmon and wild salmon. It's interesting that non-chain omega-3 content is higher in farm-raised salmon than the wild salmon because in most of the farm-raised salmon, the feed is actually is a small fish, tiny fish with high amount of omega-3 fatty acids. So it's not a good idea to feed corn or or walnuts. The big fish need to eat small fish.
Okay. Well, with that, I think as our closing comment, I'd like to thank our panel for a really great discussion, and I thank all of you for the questions. And now I'd like to let's just have a round of applause for all of our speakers.